October is Breast Cancer Awareness Month. It is done annually to raise awareness about its impact. This year is focused on We Rise, which is to ensure that every woman have access to the screenings and support she deserves. Hence, the need to further spread the news. Hello and welcome to Let's Talk. I am Olujo Kemosako. The topic is breast cancer awareness. My guest is Dr. Adeyemi Adewusi, Registrar Obstetrics and Gynecology Department, Lagos State University Teaching Hospital, LASUT. But before we delve into the program proper, as usual, I'd like to remind you to please subscribe to our YouTube channel. Your support is graciously needed. And let's just continue with the ride. Thank you so much, Dr. Adewusi, for coming on the show. It's nice having you here.
Yeah, you're welcome, Ma. Thanks for the privilege and the opportunity.
Thank you. Now, it is Breast Cancer Awareness Month. Could you please give us a brief explanation of what breast cancer is, and does it affect by age or whichever way, male, female, young, older?
Okay, thank you very much. It's actually a privilege or it's a fantastic opportunity to be on the set with you. And thank you for this opportunity. Just like you said earlier on that October is actually breast cancer awareness all over the world. Yes, breast cancer actually has what we call a multifactorial disease, actually multifactorial disease. And with respect to the question that you asked, if it is age related or if it is maybe age related or gender related, yes, there are so many factors that actually contribute to breast cancer. So just like you've asked, breast cancer in most cases is actually seen amongst women as that the previous reviews or previous education and everything, they are saying that it's actually more common amongst women that are above 50 years and 50 years and above. But now recent study has even shown that those in their mid 40s are actually more prone towards to breast cancer. And also, aside from this, also, if you look at the ratio of men and women being affected all over the world, we could actually see that it actually takes more people, the female gender is actually more predisposed to breast cancer compared to male, meaning that in the population, out of 10 women with breast, out of 100% of patients or what's it called in the population, you see more prevalence amongst the ladies compared to compared to women, compared to men. This would actually be attributed to the hormonal status because of the estrogen and the progesterone that the female body or habitus produces. That is what makes them to be more predisposed compared to men. So that is just So it's actually age related and also gender related.
So, what are the signs or symptoms to look out for?
Yes, the signs and symptoms are actually, there are so many constellation signs and symptoms to look out for. It could breast cancer in most cases, based on a particular study that we carried out last year, we realized that about 50 to 60% of the patients actually they presented with with lumps, like a swelling in the breast. So that's the number one mode of presentation that is in the early stage. But let me just put it this way: that it depends on the stage that the patient is presenting with. But the very first thing a lady would definitely experience or can easily say, okay, this is one thing I've noticed is the swelling or the lump either on the left or the right side of her breast. So aside from this lump, there are some other associated symptoms which could include ulcerations. Aside from ulcerations, and another thing about the lump in breast cancer is that they are, in most cases, not in all cases, in most cases they are painless. A painless ad-like lump or swelling in the breast, which is so unusual. And also, aside from this, there is a particular category of breast cancer that most people are not so familiar with. That even if a patient presents with such symptoms, someone that is not skilled, that is not knowledgeable in breast cancer, might actually misdiagnose such a patient. It's what we call a Paget disease. In Paget disease, the presentation is not like the typical breast cancer that you present with a lump. It's actually like a sub-entity of a breast cancer. So a patient with Paget disease will present with like a skin ulcerations. To notice like there's a swelling or a skin ulceration around a nipple area. There will be skin discoloration too. And also aside from this, there's intense itching around that area. So these are the major symptoms that the patient could also present with. And as time goes on, there's a particular feature that we call peau d'orange. I know I'm very, very sure you're conversant with oranges. You can see the skin, how the skin looks with multiple dots on its surface before you peel it out. So most patients could also present with such symptoms too, that they will notice that like there's a tiny dot on the surface of their skin around their nipple or around the surface of the, what's it called, around the surface of the breast that is being affected. So those are the major symptoms. Some patients could also present with intense bleeding. If there's ulcerations, there could be intense bleeding in such, what's it called, in such situation. Just like I said earlier on, the lump is actually the commonest form of presentation. For cases that are advanced, like stage 3 or stage 4, meaning that the cancer had spread to other parts of the body, maybe the lungs or the chest. Some of them could present with cough, difficulty in breathing. And also, aside from this, they could also present with maybe like when they cough, they'll be bringing out blood. That's what we call hemoptysis. So those are the basic features of what's it called, of breast cancer. There are so many. So if it is in an advanced stage, also, patient could also say that, okay, ever since I've been noticing the symptoms, I have been losing significant weight loss and loss of appetite. Those are the advanced at the advanced stage of the breast cancer.
So now there's something, I think it's metastatic or something.
Yes.
Yeah, can you please explain that?
Okay, just in the late term, metastasis just means spread. Do you understand? So the spread in breast cancer could actually be what we call the local spreading, meaning that the cells, the cancerous cells, they move from the breast to the surrounding tissues. That's what we call the localized, what's it called, invasion or localized metastasis, meaning that the surrounding structure, such as the lungs, such as the liver, when those breast cancer cells spread to all those contiguous structures, that's what we call a locally invasive, what's it called, breast cancer or a metastatic breast cancer. So if now, aside from that, it could also spread to other areas, just such as the brain, such as the back, the lumbar spine. It can spread into the abdominal cavity. That's what we call a distant metastatic spread. So it can affect any organs of the body, but basically the brain, the liver, the lungs, and the bones. Those are the major areas of metastasis. Those are the advanced. So metastasis just simply means that it's actually an advanced stage. So once you see metastasis, features of metastasis with a lady with a breast cancer, it means that at least she's actually at stage 3, at least stage 3. So meaning that in such cases, that person will definitely need what we call a multidisciplinary care at that period.
Now, what is the ratio of the death rate of this breast cancer?
Yeah, the death rate is dependent on what we call the staging. The earlier they present, the better the chance of survival. So what we do here is what we call the 5-year survival rates. So for a stage 1, meaning that the lump is just within the confinement of the breast, it has not spread to any other contiguous structures, and it's not as big, maybe like it's about 2 to 4 cm. So in those kind of stages like that, for patients that present with stage 1, what really happens in most kind of cases is that they have a good prognosis. I don't know if okay, let me just try and calm down a bit. Prognosis just means that a good outcome. You understand? When someone has a good prognosis, meaning that the outcome of that disease is very, very good at the early stage. So for the stage 1 breast cancer, if it is properly managed, surgically is what we do in most cases. So we tend to take out what's called the old breast. That was what we call a mastectomy. So for stage 1 cancer, they have a 5-year survival rate of about 85 to 90%. So they do fantastically well. So for the stage 2, then there's actually a reduction in the survival rate of such patients. So in such cases, patient survival rate could be as low as 80 to 75%. For 3rd stage cervical, breast cancer, the survival rate could be as low as 65 to 70%. So from anything from the stage 4, which is the terminal stage, the survival rate is less than 30% in most of the populations. And this has actually been synchronous with the research that we carried out in some of our patients. It's a highly retrospective study that was carried out early last year in this facility, and it was actually contiguous with what we found in each of these patients that were repeated for the research. So just like a quick recap, the earlier the stage, the better the prognosis. The late the stage, the worse the prognosis.
Okay, let's quickly go on this break. We'll be right back. Welcome back. If you're just joining us, the program is Let's Talk on DNTWOK, and I've been speaking with Dr. Adeyemi Adewusi. He is the Registrar of Obstetrics and Gynecology Department, Lagos State University Teaching Hospital, LASO. And the topic has been breast cancer awareness. Remember, I told you earlier that October is the month that breast cancer is always emphasized, and it's also meant to remind people that it could actually it won't lead to death if early detection is done. And then to further spread the news on how to avoid being a victim. Thank you so much, Dr. Adeyemi, for standing by. Now, the most common treatment of breast cancer is chemotherapy. That, at least, that's what I know. And it's what other ways can it be treated, and what is being done to get a permanent cure?
Now, the mode of management in most cases is actually just like I said, it's actually stage dependent. And also, because in advanced countries, we do what we call a breast conservative surgery. That is for those that present with early stages of what's called cervical cancer. So for the early stages, surgery is actually the gold standard. So, but in most cases, what we do for such cases is because the risk of recurrence is also there, depending on the histological type of the breast cancer. Because whatever you take out from a patient, you must send for histopathology. So that histopathology will also guide us if this patient is going to benefit from chemotherapy, what kind of chemotherapy. Even aside from the chemotherapy, there are also some other options, such as radiotherapy. Aside from radiotherapy, we have what we call hormonal treatments. So what they do in that histology is that once this breast or a tissue biopsy has been taken, so the histopathologists, they will do their own analysis based on that sample, and they will do what we call receptor status to know if this cancer is actually hormone sensitive or is not hormonal sensitive. So if the cancer is actually hormonal sensitive, definitely the patient will not need chemotherapy. So what they use all over the world in most cases, what we call use of tamoxifen, which is actually a selective estrogen receptor modulator. That is what they use. And it has also been said that for hormonal sensitive breast cancer, they tend to have a better prognosis than the non-hormonal sensitive breast cancer. So the other modality of treatment would actually include radiotherapy, hormonal treatments, and surgical. So surgical is actually amenable to stage 1 and stage 2. So, but in such cases, we still want to, even after the surgery, we now tell them to go and do what we call an adjuvant chemotherapy. After you've removed the breast and its all lesions and everything, we still want to subject the patient to about maybe like 3 or 6 courses of chemotherapy, just to be sure that we are not leaving any stone unturned in the patient, and also to reduce the risk of recurrence in such a patient. So we place them on what we call adjuvant chemotherapy. But for those in stage 3, what we do, first of all, we still book them for surgery, but in most cases, we still send them for chemotherapy pending the time that they come back for the surgery. So that is what we call a neoadjuvant chemotherapy, meaning that they will first of all go for the chemotherapy. After going for the chemotherapy, then they will now come back for the surgical approach. So, but in most cases, maybe because of our level of education in Nigeria here, most patient that comes out with maybe like that has been diagnosed with breast cancer, and it's okay, madam, please, you will need to do chemotherapy before this surgical procedure. So the essence of that chemotherapy is to help to downsize the size of the tumor size. So what happens in most of what our experience has actually shown us in the past few years is that once you send the patient for neoadjuvant chemotherapy, that chemotherapy tends to shrink, even in most cases, or in some cases, it shrinks the fibroid to the point that the woman does not even feel any lump again. So left to her, she feels that, oh, I'm fine, I'm okay. And she doesn't come back for follow-up. She doesn't come back for the surgical procedure. And those are the patients that are actually predisposed to subsequent reoccurrence in the nearest future. So these are the options of management: the surgery, the chemotherapy, the radiotherapy, and the hormonal treatment. So, and in like in advanced countries, there's something we call target therapies. So that one is actually an advanced form of form of management that, although we've not been able to institute that in this part of the world, but in advanced countries like US, UK, they do what we call a target therapy.
So is there something going on to actually get a permanent cure?
Okay. One thing is this. Once it is okay, if you, so we need to understand the basics of what's called cancer. It's a genetic abnormality. So nobody can actually say that, okay, I've actually been cured from what's it called, from breast cancer. Even from those that have actually done what we call a prophylactic mastectomy, meaning that they have a family history of breast cancer, and by the time they are done with their childbearing age and everything, they came to the hospital for the removal. Not that we saw anything from the histology or from the maybe like from the histology or from the mammogram that they did or anything. We just removed what's called the breast because they have a family history of breast cancer. In such a patient, the chances of coming up with what's it called, with features or signs of recurrence, it's actually very, very minimal compared to someone of that same category who has not undergone a prophylactic mastectomy in the past. So we cannot really, really beat our chest that, okay, there's a permanent cure for what's it called, for breast cancer. Although there are still so many research that are still going on presently to actually look for a permanent cure for what's it called, for breast cancer. But as of today, there is no any permanent cure. The only thing we can just reassure the patient is that if you have any family history of what's it called, breast cancer, quickly come on time because that could actually save your life. And if you've been diagnosed with what's it called, breast cancer, please quickly come in as soon as possible in the early stage because that helps to increase your chance of survival after the what's it called, after the treatment has been taken. So there's no any permanent cure as of today.
So, okay, to further delve into safety measures and all, what are the precautionary measures that should be taken to avoid breast cancer? Let's talk about food and other stuff.
Actually, breast cancer, looking at the origin and the pathogenesis of breast cancer, it's actually a Western thing. It's not an African thing. And this could actually be akin to the dietary lifestyle, sedentary lifestyle that is actually more common amongst the what's it called the Western world compared to we Africans. So although it has been said that breast cancer is actually the commonest form of malignancy, especially in females, you understand? So it's actually a Western thing, but because we've been trying to imbibe what's it called the eating habits, the sedentary lifestyle of the Western world. So it's now becoming a thing of concern in our own environment. So basically, the basic thing to be done, it has also been shown that women that are postmenopausal, women that are maybe like few years gone beyond their postmenstrual period, maybe like around their 50s or 60s, that are actually obese, they tend to have what we call, no, they tend to have a breast cancer. The risk of breast cancer in them is actually higher. So just like I said, obesity, that's where I'm going to. Obesity is actually a major risk factor. So sedentary lifestyle is very, very important. So you need to avoid a sedentary lifestyle. So regular exercises is also very, very important. And also aside from that, your dietary lifestyle, eating a whole lot of fat, foods that are actually rich in cholesterol, because all these tends to store in the body system. And before you know it, they produce what we call estrogen. And estrogen has been said to be a major predisposing factor to the most occurrence of what's called of breast cancer. So avoidance of sedentary lifestyle, even alcohol consumption too, has also been shown to be a major contributor to what's called to breast cancer. And also aside from this, there's a particular product that we call, or a micronutrient that we call phytoestrogens. Phytoestrogens are just like they tend to reduce the amount of estrogen that is in the body system. And you could actually find most of these phytoestrogens in maybe like in meals like soya meals or apple, vegetables, and most of these was called citrus fruits. So it's actually advisable that we inculcate the habit of taking a whole lot of vegetables, reduce alcohol consumption, even cigarette smoking at times to have also been said to be what's it called to be a contributing to be a contributing factor to breast cancer. So with this kind of lifestyle, definitely it could also reduce the chance of what's it called of developing breast cancer. Because there's also been said that even in those that does not even have a family history of breast cancer, but because of these modifiable, we call them modifiable risk factors because these are the things that you can do to prevent what's it called to prevent the breast cancer. The non-modifiable things are the age, the sex of the patient. If the patient has a genetic predisposing factor, like she has a family history of breast cancer, in those cases we call them non-modifiable because there's nothing anybody can do about it. You're a male, you're a male, you're a female, you're a female. You understand? There's family history of cancer in the family. There's nothing you can do about it. Or your age. There's nothing you can do about it. So we call them non-modifiable risk factors. But the modifiable risk factors are the things we really should inculcate or imbibe in order to reduce the risk of breast cancer in our environment or within our vicinity.
Now, on a lighter mode, it's been serious so far, so let's have a little, something to ease the pressure. Now, there is this interview making rounds on social media. Men are enjoined to suck breast this month. What good will that do?
Okay. Talking about. Okay, I think I'll just talk about the protective factors for breast cancer. Those are just postulations. You understand? Those are just postulations that are not scientifically proven. You understand? So people can come down with so many things. Just like someone, I think there was a time I was on Instagram and I saw a lady that actually delivered maybe like some few days ago, and she took the placenta of the baby and she chopped it into several pieces. She boiled it and she ate it. And news went round and said that, and it was sent. She was like, oh, okay, it helps to rejuvenate the, what's it called, whatsoever nutrient the woman had lost during the course of pregnancy. So those are just postulations that have not been scientifically proven. So, but the major things that are actually beneficial for a woman to reduce the risk, we call them protective factors, is actually breastfeeding. Breastfeeding, the use of what's it called, hormonal contraceptives, is also that it has also been said to be beneficial in what's it called in most of those cases, and even the use of hormonal replacement therapy, maybe for a patient that actually had, maybe like she's in a postmenopausal period and she's having some postmenopausal symptoms, or maybe she's postmenopausal but she still wants to be seeing her period regularly. So those are the basic beneficial factors. Breastfeeding, very, very important. And there's also been said that breast cancer is actually more common amongst women that have not given birth before. So so we call them nulliparous, meaning that she has never had any parous experience. She does not have a child. So they are actually at a higher risk of developing breast cancer compared to those that have maybe like 2 children, 3 children, 4 children. So that's why it is important that when you come to the hospital, the doctor will ask you, okay, how many children do you have? Did you breastfeed? How long did you breastfeed? Because all these are protective factors against breast cancer, not the sucking. Those are just postulations, not evidence-based, as
Okay.
of today. Because science can come back maybe like in the next 2 or 3 years and say that, okay, yes, it is actually true, but there's no any scientifically proven evidence for that. And no studies have been carried out.
Hmm. Thank you so much for that. Do you have any final word?
Okay, just like you've said, okay, and I think another thing also is this, the screening aspect is also another important area that we should be really need to talk about, especially for those with family history. My mom had breast cancer. She died as a cause of it. Or maybe I had a younger sister or an elder sister who has so that is related to breast cancer. Such a patient or such a person needs a closer, what's it called, monitoring or a screening exercise. But it's unfortunate that you don't really have a specific form of screening exercise for a breast cancer. But although there are several modalities that could actually be put in those with family risk of what's called family of breast cancer. So in most cases, generally, we tend to such categories of people with family history of breast cancer. So we can actually advise them maybe like from the age of 45 or 50 and above, they should do what we call a regular screening of what we call mammography. Aside from the mammography, especially in the advanced world, they could actually test them if they have that gene, because there's a gene that is causing that family history of what's called breast cancer. I think an example of such a patient of such a person is what's called, I think Angelina Jolie. Angelina Jolie actually has a family history of breast cancer, but by the time she was done with her reproduction and everything, she actually opted for what's called prophylactic mastectomy, and she's fine. You understand? Because those with family history of breast cancer actually have maybe like they're actually 10 times. They have 10 times what's it called incidence of developing what's called breast cancer in subsequent future or throughout their lifetime. So it's also very, very important. So, and lastly, this will be my closing remark. Self-breast examination is very, very, very important. And I think that's the essence of this particular, of this particular show, just to create an awareness that a woman ought to self-examine her breast. So we do a breast examination in 2 ways. There's something we call the clinical examination and the self-breast examination. So every woman must learn how to do what we call a self-breast examination, which is very, very important. But your clinical examination, which is going to be done by a professional, by a doctor that is certified in that field, that one can be done at least twice in a year. But a self-breast examination, every lady should be conversant with it in order to reduce the incidence of breast cancer in our vicinity. Thank you very much.
Thank you so much, Dr. Adeyemi Adewusi. It's nice having you again. Thank you. And to you out there, thank you too for being part of the show. It is Breast Awareness Month, And like he said, ensure that you do self-screening and perhaps take another step by going to the hospital to check yourself. Until next time, when I come your way again with another exciting topic, I remain Uluja Kemasako. Bye for now.